Hello, listeners. Welcome to Views on Health. Back with us on the program is Dr. Indunil Piyadigama, consultant obstetrician and gynecologist, Base Hospital, Kahavatta, who is going to discuss abnormal menstrual bleeding. I'm sure you recall that last time around, Dr. Indunil Piyadigama discussed menstrual bleeding. Now we're going to look at other aspects of this normal phenomenon in any woman, but the issues that lead from this normal cycle to what medically can be considered abnormal. Over to you, doctor.
Thank you very much. So as Ms. Fatima mentioned, we discussed a lot about, we started on this topic basically as to what is normal menstruation and what is abnormal menstruation. So today what we thought was we'll discuss a little bit more depth into abnormal types of menstruation. So starting from the things that you would realize, one thing that people would be really caring about is the amount of bleeding that they will be having. So as I mentioned, it's most likely a feeling or the perception that the woman have whether this is normal to her or whether this has changed in pattern over time. So some people experience heavy bleeds. Heavy bleeding is the one that we are going to concentrate on today. So in one part that we are going to concentrate today. So heavy bleeding in the sense they will start experiencing clots and then sometimes will spill their undergarments and will stop them from going to work because they can't stop the amount of blood that is coming through. Or else it may be that they are feeling really weak once they have this sort of a bleed. So if as a medical person to look at this in a objective way, what we do is we check on their blood levels of what we call the hemoglobin levels in the blood. So the women who have heavy bleeds will have low hemoglobin levels in the blood. So that way we can confirm that this is likely to be not just the perception of the lady, but also there's absolutely a problem that is going on within the reproductive tract itself. So when it comes to this kind of heavy bleeds, there are different causes that may have contributed to it. So as a rule, we divide into two types of causes. One may be the structural type of causes. That is, there is a defect in the anatomy or the structure of the reproductive tract. Or the other type may be that there is a functional problem. That is, it's all about, not about the actual way the structures are there, but the things that are surrounding it to help control a bleed or to have a bleed, whether these enzymes, hormones and all these other surrounding factors, whether they are correct or not. So those are the main arms that we have to think about in this kind of situation. Now, from going back into the previous discussion, now different age groups will have different reasons to have heavy bleeds. So that is also is taken into the picture when assessing this kind of a problem. Now, if we go into details, now what are these structural problems? So as you might have all heard about something called fibroids. Fibroids is a growth in the muscle layer of the womb. So what happens is when there's a large growth within the muscle layer of the womb would not be able to contract as efficiently as it is without a fibroid. So that might lead to heavy bleeds. Also, these fibroids can sort of change the shape of the cavity of the womb, or the internal lining, the shape might have changed. So that may also lead to heavy bleeding. So this is one structural cause that I told you about. Then if we take this a similar type of another structural cause is named adenomyosis. That is where it's not exactly the fibroids that are there, but this kind of picture coexists in the whole body of the womb. In the fibroids, we might find it here and there, one or two places. But in adenomyosis, the whole muscle layer of the womb is distorted and unable to contract properly, which leads to heavy bleeds. Then other things we can talk about is some things like polyps. Polyps are small growths, and especially the endometrial polyps we call it. That is a polyp jutting out from the cavity of the internal lining of the womb. That may be the reason for the heavy bleed. Then thinking further about the more disastrous things, cancers can also lead to this pattern, and even sometimes it may be the precancerous lesions that we call it. That is, before the spread of the cancer, it may be the earliest sign that we'll be seeing as evident as a heavy bleed. So just to talk about these things now, I previously mentioned that depending on the age, the common problems can vary. Now the cancers is sort of a later on life problem. So if somebody comes at 45 years with heavy bleeding, we might start thinking from the cancer and going back, because that's what we want to exclude. But if somebody coming at 20 years of age, it may not be the case for us to think first. Okay, so this is one thing that I want to talk about, the structural causes that can lead to heavy bleed. Then moving on to the other things, I said before there are some functional causes as well. These functional causes can be problems with a woman's blood clotting mechanism. So when there is a bleed, that means there has to be a proper clotting mechanism in the body to activate to arrest this bleeding. So if this doesn't happen, then there will be heavy bleeds. But as I've mentioned earlier, so now this clotting problems do not sometimes occur all of a sudden. So it might be evident in a very young girl, because once they start bleeding first time, second time, third time, if it is heavily bleeding all the time, then it may be a problem with the coagulation system rather than any other problem within her body. So this is one. So then what are the other functional causes? We were talking about these hormonal changes in the last session that we had. So if there are problems with the hormones, and if there is a problem with ovulation, that is production of eggs, so then there may be heavy and abnormal types of bleeding patterns. Other than for that, it may be just the function of someone's endometrium or the internal lining that may be leading to this kind of bleeding. So nothing to do with the hormones on the in the body or the structure, but it may be just the endometrium is not properly functioning. That may be the reason for the bleed. So those are few other things. Then sometimes it may be certain things like certain medications that they take. Suppose if somebody is taking medications that will thin their blood or that will lead to heavy bleeds, this person will have heavy bleeding during their menstrual cycle as well. So this is just to touch upon certain type of the things, so that we can elaborate about these things a little bit, so that the listener will understand. So now the next thing is, if I carry on, if the time permits, now how would we assess whether the person is having this kind of abnormal things within themselves. So there are different ways of assessing, but the main tool that we use is we take a proper history. That is, like, we try to formulate what is happening within, what happens before, what happens in this cycle, what is your family history, things like that, and we will try to come to a conclusion as to what is the most likely reason that the person is having heavy bleeds. The next step is we will go on to examine. So if somebody is not sexually active, what we do is we try to do a abdominal examination, which may not give us much information, but the best thing is to do a internal examination. So that is to feel the womb and the surrounding structures within. So that way we'll be able to get a better idea about the structure. Then furthermore, going into next level, doing a scan, that is what we initially do is a ultrasound scan, we'll be able to further look into what is happening within the womb. So just to mention few things, ultrasound scan also best done internally, where we'll be able to see the womb and the surrounding structures very closely. But if somebody is not sexually active, then we might have to go to for a lesser option, that is to try to scan through the abdominal area. Then depending on this scan, then we might think of doing other investigations as well. Like some people might have a dye or a saline inserted into their womb to look into the cavity of the womb, so which might enhance what we are seeing within. These are not major procedures, but they may be a little uncomfortable, but will give a lot of information as to what is the reason for this condition. Then if we move on to things like blood investigations, there are things that we can do where we can look for how the blood clotting happens and how the hormones work in the blood. So all these things can be checked by doing blood tests. So those are a few basic things that I wanted to talk about, how to evaluate for this abnormal type of bleeding.
Doctor, you said that abnormal bleeding will happen in different ways with different groups.
Yes.
And that's obviously stands to reason that a young girl may not have the same
pathological
issues
processes
as somebody older. So obviously age-wise or certain age groups will fit into one sort of category or pattern, and it'll go on like that.
Yeah.
But finally, doctor, there is an issue now. If this abnormal bleeding sets in at an early stage, can it be addressed? You have outlined certain the causes, that are structural and functional, and then of course you'll obviously treat it accordingly.
Yes.
So in which case, if it happens to somebody maybe in their teens, could then that be addressed, can be medically addressed, and you can regularize it so that abnormal sort of comes away and it becomes a normal menstrual cycle.
So what you're talking about, a teen, is applicable for any age, I would say. So what happened previously, maybe about 10-20 years ago, if somebody is having heavy bleeding, what they would have is a hysterectomy. That is, they will have a surgery and removal of the womb. But that doesn't happen anymore. So in any age group, there are different ways of sort of treating these problems depending on the cause, rather than going for very hazardous or absolute ways of treating. So if we take young women, there are a lot of medications that we can use that can control the pattern of bleeding. It all depends on what is the reason that would have led to this kind of bleed. Now we say, we will, if we think about a middle-aged lady who may be bleeding because of, we'll say, fibroids, it might not be the case that she doesn't need a hysterectomy. There are different ways we can just remove the fibroid and restore the womb back to its normal way so that the bleeding pattern can be taken back to normal. And suppose now if it is something like a later on problem with the endometrium, as I said, maybe some problem with the growth in the endometrium, we may be able to just remove that growth. And sometimes if for maybe around somebody who has completed their family, rather than going for a surgery, we can go for what we said, minimal invasive ways of controlling, like just ablating the inside of the lining of the womb, which we call it endometrial ablation. So these are all different type of method of managing this. And there's also a group who might need a surgery, that is a hysterectomy, to remove the womb because it may not be amenable to any of these methods that I've been talking about.
Are there cases where once this has been treated and can it recur after a few years?
Yes, there are cases like that. Now, say fibroids, we remove it. Sometimes there may be a little growth that is not evident at the time of the surgery. Over the next 5 years, it might grow back again and lead to the same problem. So that is a issue. Then some people, we say, maybe around came at around 45. We had a look and treated. Everything was fine, but still she's continued to have this. That means she needs another evaluation maybe, because it may be something that was not there before, or she may be having an early onset of a cancerous cancer cells, which was not there maybe 6 months ago or a year ago. So still, if there are problems continuing, again we need to evaluate and look for what is the cause for it to be continuing, and then start on the treatment again.
So all this entire situation is sort of comes within the ambit of the structural and the functional causes.
Yes, that's how we would categorize it for us to be able to properly evaluate it in a proper way.
A question I should have asked you earlier, Doctor.
Yes.
Is this a common condition amongst women?
This is a very common condition. So basically, I would say almost any woman, so each one of them would have at least had one visit to a GP or a gynecologist because of a bleeding problem in their lifetime. So that is how common it is.
So in other words, almost everybody is affected
Yes.
at some point in time.
At some point in their life, almost everyone is affected.
So if it's addressed, it's under control.
Yes.
But are there people who may ignore it and just continue?
There are people who has ignored and just continue. And sadly, most of the time, these are people maybe like in their 50s, 40s and 50s, or where they have sort of completed their family and they are not really worried about their health. So these people, and we have encountered many of them who are having cancers at the end of the day. That may be the reason. And for the bleeding, if they have come to seek treatment earlier, it would have been really sort of completely curable. Completely would have been cured. Because I just wanted to touch on this, because endometrial cancer is something that is emerging because of the lifestyle trends, then the obesity, diabetes, hypertension. These are all contributing towards endometrial cancer. And if you take now Sri Lanka is also edging towards that side. If you take the developed world, endometrial cancer is the number one gynecological cancer in women. And the good thing about endometrial cancer is The cancer grows in the endometrium, and as like menstrual bleeds, it's very open to outside. So therefore, there will be bleeding. So before it goes further, it will be evident very quickly. So therefore, if you get evaluated quickly, and if you sort of identify it quickly, more than 90% will have complete cure. So they will have completely normal sort of a life afterwards once it has been detected.
So it's that age group that is of concern.
Yes.
40 to 50s.
That is the major concern. But still, there are some people who are having high risk for this kind of condition. Now, even you're 35 years, if your weight is about 90 kilos and you're not having regular cycles and very irregular bleeding patterns, having diabetes, hypertension, or somebody in the family having cancers, they're at very high risk of having a cancer which needs to be checked. So it's not just the age, but the overall person that we have to evaluate.
There are other contributory factors.
There can be
like
all other
NCDs that
yes,
contribute towards this.
yes.
So, doctor, this is very interesting because one would not associate high blood pressure or diabetes with a cancer in the sense that it will lead to cancer. You might think that high blood pressure will give you a stroke, or diabetes will put you into a coma. I mean, you will feel, there are sort of related problems. But that it will go towards where a woman is concerned to affect her womb, the lining of the womb, is something that I think that is quite new to me.
Okay.
So very interesting, Doctor. Time has caught up with us. This always happens, and I'm reluctantly compelled to curtail these interesting medical discussions because of the time factor. So what would be your take-home message?
So take-home message is basically, if you feel that you are having abnormal pattern of bleeding, even if it doesn't fit into all this medical jargon, then what you need to do is to seek medical advice. And a doctor will, depending on all the circumstances around you, will decide what would be the next things to be done. And if a diagnosis is made or whatever the reason is found, then most of these things are treatable with simple methods. And even if it is a cancer, if it is detected early, that can be treated completely without a problem for the future. So, and the other thing that I want to let know is hysterectomy or removal of the womb is not the only way of managing bleeding problems. There are a lot of other ways of managing, and there are a lot of other what we call minimally invasive ways of managing these kind of problems. So therefore, seek advice early and then get your treatments accordingly.
Just a question that I would like you to address. Would the abnormal bleeding be associated with pain?
That is, as I said last time also, it can be associated with pain, and most of the people, when they have abnormal bleeding, will have increased pain. And this is also one symptom that we look into when we try to formulate what sort of cause that is leading to this bleeding.
Thank you, Doctor. Well, listeners, on that note, we end this very interesting discussion on abnormal menstrual bleeding. We thank you, Dr. Indunil Piyadigama, consultant obstetrician and gynecologist, Base Hospital, Kahawata, for sparing your very valuable time and coming to our studios, and of course, your sharing your valuable expertise on this topic with our listeners. Thank you, Doctor.
Thank you very much.
We look forward to your presence on the program in the foreseeable future. Thank you too to Damayanti Kolabage for technical assistance. I'm Fatima Razi Kader, saying good night and looking forward to your company next week, same time on Views on Health. Bye.